Okay. All right. So welcome to the August 11th meeting of the KDE Commissioners Student Advisory Council meeting. I'm excited to see everyone here today. I wanted to first go over just a couple of, just a few things before we get onto our agenda. We do have our interpreters here for our students from the Kentucky School for the Deaf. And if I could get either Beth or Regina just to go over how we can, the rest of us can see the interpreters. If someone could just give us a brief view on how we can get those pinned to our videos, or what we need to do in order to make this experience good for our students from the School for the Deaf.
Sure, Tony, while Regina is working, I think, with Anna, I will try to address that. So the best bet is if you want to see someone continuously throughout the meeting, you will hover over their picture and their name will appear. There will be a set of ellipses or 3 dots. You can select that and a small menu will pop up, and one of the options in that menu will be to pin them. You can pin one or more videos. So for example, I'm looking at interpreter Audrey. I could pin her. I could also pin the commissioner, and I could pin Tony. So you would pin the videos that you want to remain on your screen at all times. And if you don't have that option, please let us know, and that'll be another thing that we can certainly work through with you, because we have discovered that some people have different versions of the software. Okay. So does that help, Tony?
Yes, I just want to make sure, because we want to make sure this experience is good, obviously, for all of our students, and just to make sure, because I know, again, I wasn't aware that we were having some issues with the different versions. So just to be clear before we start on that. And you certainly don't have to pin people, because as people talk, I know the different videos pop up and such. That's just kind of how Microsoft Teams works. And so that's how we go about. So, all right, so we will go ahead and start the meeting. Interim Commissioner Kevin Brown, are you on with us? You want to give us a greeting?
Good morning, I'm here. Thank you, Tony. Thank you, all the students for coming together this morning. I know we are having more advisory meetings than we might normally have in a normal time. We're not in a normal time. As you've heard me say before, this is our most important advisory committee. Don't tell the superintendents or your principals, please, because they think they're the most important advisory. The reason we're bringing you back is because you have already given us so much actionable feedback. The last advisory that we had, I know you had a kind of an unofficial meeting with Tony on some housekeeping issues last week, but the last actual advisory we had, I'm using as a textbook example of how an advisory should work. And I'm not talking about how we go about it, but how advisory members respond, engage. I had a task force meeting yesterday with various education partners, and they're all wonderful partners and they're professionals and they're doing a great job, but it was quiet and it was silent on a lot of questions. And when we have an advisory, we need to do less of the talking, and we have to do some talking. We have to give you the materials, but we want to hear from you. You all did a great job of that. Last time it was wonderful. Everyone added to the conversation, even if you didn't speak up on the call, you added in on your exit slip, or you've been in contact with Tony in between. That's exactly how we want an advisory to work. I will be bringing this up to the other advisories. That student advisory is, in my opinion, currently showing the others up based on your actionable feedback. So that's why we're bringing you back. A lot of things going on, of course, in our state. As you heard, the governor announced the recommendation yesterday about the delay of in-person classes until September 28th, which is something that none of us wanted to hear, but we know that we all have to act together. And I call it the education family, to do what's best so that when we do get back in-person classes, we don't have to then abruptly come back out, and that's the goal. And we're seeing that happen in other states where they, for example, Georgia, they went in too quickly. They ended up having at least one school district had to close a few days later, and over 250 staff and students in quarantine. So We want to take the more measured approach. We want to be, this is going to be a marathon, not a sprint, and you're going to help us get there by giving us your expertise and your feedback. So I'll be on the call the entire time. We have a full agenda, and we actually just had an agenda item that came up that we're going to ask you about suicide prevention training. Came up this morning about some decision points we're going to have to make at the state level. So that's just one example of the actionable advice that we need from you. So Tony, I'll turn it over to you to go through the agenda.
Great. Can you all see my screen?
Yes.
Okay,
Yeah.
great.
Also, just before you get started, I just wanted to say that Dr. Glass, of course, he's unable to be with us today. He is not officially started, of course. I'm still here as the interim commissioner. He will start September 14th. He's able to join us a little bit between now and then, and he was obviously able to join us on the call last time, but he certainly sends his regards and is excited to start working with you all full time. I just wanted to give you that message.
All right, so I'm just going to quickly go through a couple of these slides again, because I know because we have so many new students that are joining the advisory council, and you guys are getting thrown a lot of information as we're trying to get our guidance documents and things to you. I'm hoping that you are now receiving the emails from the news releases. I hope those are helpful for you, so you can kind of keep track of what's going on in the department. So I'm going to go through this pretty quickly. This is kind of the same information that we provide to our superintendents. And so this is our agenda for today. So we're going to go over career and technical education and COVID-19. We will have David Horseman, our Associate Commissioner, Leslie Slaughter, Executive Advisor for the Office of Career and Technical Education. And then we will have another representative from that office as well. And then Dr. Connie White, I know that many of you have probably seen her. She's kind of our liaison she's Deputy Commissioner for the Department for Public Health, and has been really our person that we have worked with hand in hand since the beginning of the pandemic with implementing some guidelines and such at the department, along with Dr. Kelly Foster, who you met last week. And then we have two new guidance documents, or one guidance document on library media centers we're going to go over with and get some feedback from you. And then also a very serious topic, but we really need some advice and some feedback on suicide prevention training during the time of COVID-19. So I think that with this full agenda, we'll get started right away, and we'll update you also on your projects. I know you're excited to share about that as well. First and foremost, I wanted to give you an update on the coverings for kids. We have 53 districts that have started on that. I know several of you have indicated you're going to be helping, and we will be back in touch with you. I know several people in my office have helped with getting you in touch with superintendents, and we'll continue to do that with you. This is just for you all. These are going to be attachments for you to know where to find our guidance documents. So that's our home page, and that's our COVID-19 page. And this, on that green tab, is where you can find the reopening guidance. So all of the guidance documents that we've issued for our reopening schools are in these areas. And again, this is really for you all to know where to find everything, because I know last week you were not really sure where to find where all the documents are. And this week we released two different guidance documents. It was the Library Media Center and class sizes, and the virtual programs and courses. And those two are right there at the end. We also have the answers to the FAQs that we've been giving to our schools and districts. And again, there's a link right there in the top of the sheet that you all, I'm going to send this out. There's more than 700 questions that have been answered since March that you can pretty much put in any question. And these are questions that we keep updated every week. And with that, we're going to move over to our first agenda item with Tom Thompson with the Department of Career and Technical Education. Also, I don't know if David Horseman and Leslie Slaughter, if you want to introduce yourselves as well, you might be talking.
Good morning, Tony.
Good morning. Is that Tom?
Mr. Horseman's not with us right now. He'll probably join later on.
Okay.
he can't join us right now. Leslie is on here, I believe, if she wants to introduce herself.
Okay.
Yes, good morning. Great to be with you guys. Leslie Slaughter. I'm the Executive Advisor to the Office of CTE, Career and Technical Education, here at the department. And I think I speak for most of my colleagues when I say it's a great day when we can be with students. So I'm happy to be here with you today. So Tom's going to kick us off and then I'll wrap things up.
Perfect. Thank you, Leslie. So, so I'm Tom Thompson. I'm a director in the Office of Career and Technical Education in the Division of Technical Schools and Continuous Improvement. My main role is to oversee the 51 area technology centers, but also I've been working on some of the COVID-19 guidance that directly impacts them, but it directly impacts CTE in general. So some of the schools that you folks are in are impacted by that guidance. But also, I think the main thing today is once I go through and share a few tips, or not tips, but a little bit of that information, I would like to just get feedback from you moving into the fall to see what your biggest concerns are. So I've just got a slide with some questions I'd like to get feedback from. So with that said, Tony, could you, there you go, thank you. So a little bit of background information. During June, of course, when the schools shut down, it also shut down dual credit, the lab-based portion of dual credit, and it also shut down some of our industry certifications. So during the summer, during June, KCTCS worked with the governor's office and came up with a plan to allow some limited continuation of lab-based dual credit coursework. And then in July, or on June 29th, we released this document. This guidance was for area technology centers and local CTE centers programs to allow students to come back in and finish industry certifications and some of the lab-based dual credit coursework for those programs that they had dual credit labs in. So once that was released, that got us into where we're at right now. And actually that guidance is still good and some of that work is still happening. Next slide, please. So that particular guidance is, or what was broken down into general requirements, arrival and dismissal, transition between classrooms and labs, and there were some area-specific guidance in there about classrooms, lab, computer labs, and then CTE lab areas. Next slide, please. So this is the part that we need your help on. We've got a few guiding questions on here that I'd like to just get feedback from you. And I think Commissioner Brown had mentioned that this advisory gives a lot of good feedback. And so I'm hoping through these questions we can drive forward with this and meet any concerns that you have. And then that way we can update any kind of guidance. And I think from previous meetings, we've mentioned that this guidance is living documents. So as the guidance changes, CDC guidance changes, as concerns are brought up to us, then we change our guidance. So I'd like to get that feedback from you. So first question, when thinking about hands-on learning and a return to in-person instruction, what concerns do you have as a student? And when I say hands-on learning, it could be a CTE lab, but it also could be a science or chemistry lab that you're working on things. So what concerns do you all have about coming back to in-person instruction in that type of environment? Any hands raised?
I'm going to go ahead and stop sharing my screen and put the questions in the chat so that we can continue to have a conversation.
Perfect. Thank you, Tony.
And I know we have several CTE students in this mix.
So some examples I can think of, if I'm in a welding classroom or a welding lab, you know, I'm going to have to be using those tools and equipment and some of my personal protective equipment. Is there any concerns about that type of thing? If I'm in an agriculture lab and I'm working with the plants or I'm working with some of the equipment in there, are there concerns related to COVID-19 around that you all would have?
Yes, Anna, go ahead.
So, since the equipment is being highly used, I think that having available cleaning supplies would be a big concern, just for protection from the virus and any other germs with the students touching it.
Perfect. Thank you. Any others? I see another hand up.
So, Layla?
Hi. So what I mean, I understand that through CTE learning, you're gonna have to have hands-on equipment. But one of the concerns that like just comes to my mind is, of course, like Anna said, making sure that the supplies are clean and the tools are clean. Also, let me know if anything's not clear. I'm in an area where there's not the best reception. But as I was saying, I think one of the other concerns is like, for example, I have a friend that is interested in, well, has been part of CTE learning and has a very bad immune system. And so in cases like this, if we were to go back to school, it's possible that students who may not be in the best medical condition and just can't risk going back to school with like just any type of exposure, then they would be limited, like have limited experiences in school and what they could actually learn from that. And so that's actually, like, I made some notes about the guided questions that you listed, and that's actually sort of connecting to any type of career and technical education, if that makes sense, because there are students that I think, like, just in general, because right now we can't necessarily go back to school. Our 2021 to maybe 2025 graduates might have like sort of a delay in their performance compared to our past generations and like much younger generations, if that makes any sense. I know I just sort of like branched off there, but that was just another point that I had.
No, I think those are good points. Tom, did you want to?
Very good points. I do want to point out that we've been trying our best, and in course, in a virtual environment, when we go NTI, if a district goes fully NTI, we are doing our best to supplement that hands-on training. Now, of course, you can't supplement, you can't replace the experience of sitting there running a lathe in a virtual environment, or running a welder in a virtual environment, or planting the actual plants in your greenhouse. But you can have students plant things at home to supplement that. You can have students practice in a virtual setting on some of those things. Now, you can't replace it, but you can practice it. And what we do want to do and make sure is that we're giving you all the theory that we can during the virtual time in the event that we can get you in person. So I really appreciate your comments, and I've written down a few notes here because I would like to make sure that I keep that on the forefront whenever we move forward, if we start changing any of the guidance. Thank you.
Okay, Viviana?
So I'm in the biomedical science pathway, and so we always like share PPE, like goggles and stuff like that. So like a possibility could maybe be to like assign specific PPE and equipment to specific students for them to like keep for the entirety of the year, to limit the spread of like germs from people using it like on and off, so that it's more personalized and sort of like contained.
Great feedback.
Great. All right, Caleb?
Hey, can you all hear me okay?
We can.
Yes.
Okay. So I was just going to kind of add on to pretty much what everyone else had said. It's difficult to try and learn about a career or to learn a trade without, using those hands-on experiences. My biggest concerns are the impacts of offering online-only instruction, while also trying to offer in-person instruction in a clean environment. Health and safety, it's important to find a balance between health and safety, and also a balance between adequate instruction. And so I just wanted to add that, that I'm concerned mostly about the impact of offering online only instruction, given that learning the skills necessary to work in a field, it's difficult to do so when you're trying to learn through online simulations and that type of thing. Thank you.
I agree.
Okay. Let's see if I have any other hands here. Viviana and Solila, did you have any other questions, or are your hands still raised from before?
I did have one other thing to add on, just really quick. Sorry about that. So one thing that so I think Sophie or Sophia mentioned this in the chat, but one other thing that I think is important, well, just like I would recommend, I guess, is that I'm sure that there will be a need to have to share some sort of like equipment, because I mean, you don't have necessarily have equipment for like each individual to complete their own lab or whatever it may be. And so I know that, I think so if I'm saying your name wrong, I'm so sorry. I want to check what it is. I think it's Sophie. Sophie mentioned that we could like have smaller class sizes, but one other thing that I would like to mention is that if it's possible, if teachers could assign like equipment to a certain group, just maybe like a handful of students, just to avoid any type of like cross exposure with like more students, if that made sense. So that if there were to be a case that like a positive like COVID case, then we could like track down easier, if that made sense, track down what who they've been around the most, if that made sense. And it could just sort of limit all the possibilities of like how many cases could come up, if that made sense. If it doesn't, let me know.
No, it makes perfect sense, and I think it's a very valid point to help with contact tracing. If you have them in those smaller groups, even if you're cleaning the equipment, I think there is still that potential that be passed on, and you would at least have it narrowed down. No, I appreciate your feedback.
Great. Let's see if there's is there another one in there? Making sure. Anybody else want to have any observations or answers to the guiding questions? Logan?
One thing. Oh yeah. So I think so CTE is all about, like your future career. And like right now, I know we're starting back with NTI. So, it's hard. I took a cooking class last year. I'm in that pathway, and you can't really, it wasn't expected for us to cook at home just because not everybody has all the materials. So I think looking at what other things that you can teach students for their careers would be kind of, I guess, rethinking what CT is all about. And it's about like teaching you about your future career. So aside from the actual hands-on skills, what other, I guess, soft skills can you learn from CTE classes, I think would be important to look at, just because that's something that you can kind of teach over like a computer, more than, actually hands-on skills without the supplies that students would need.
Thank you. Commissioner Brown, I believe you're right. These folks have great feedback.
We have a really, really good group this year. Nashawn? I think you had something you would like to add? You might be muted.
Yes, my apologies. My Wi-Fi is acting up.
Okay.
What I had said in the chat was what came to mind immediately is that certain students, at my school at least, they usually do it out of defiance or not really knowing what the current situation is at the time is. But if they're not following the proper guidelines as everyone else is doing, then they would be at risk at putting everybody else in harm or putting themselves in harm when the guidelines are specifically to stay safe and healthy while still doing in-person instruction or hands-on learning.
Good point.
Very good point.
Okay. Drake?
My concern was just about like, if we can't meet in person, how are we really going to get those like hands-on skills? And so I was just wondering if there would be any like way that students could come to their ATC in really small groups to see the demonstrations, even if they can't like actively participate in the activities.
I think that is a possibility moving forward. I think it's just going to take some planning on the part of the sending district, the ATC, the student, and the parent. And it depends on what guidance the governor has given us at that point. Right now, as long as we're up to yesterday's announcement, I'm not sure where we're at right now, but we were letting small groups come in and do some of that in person. And our intent was moving into the fall that if students were on NTI and the district, the superintendent, the principal, the parents all agreed, then we would allow them to come in and do small group in person. And then some of them were on AB schedules, so some students were there on, or were going to be there a couple of days a week, and then the next group would be there a couple of days a week. So we are continuing to look at those options, and will continue to look at those options as long as everyone involved is agreeable to it and it meets the governor's guidelines and CDC guidelines.
Great. Peyton, I believe your hand is up.
Something else that I'm really concerned about is to go along with their CTEs are the career and technical student organizations that run with them, because that's how a lot of kids get their social interaction. A lot of kids become more involved with schools with those clubs and organizations. There's a lot of project-based learning within those. So one thing I'm concerned about is keeping students engaged with those. Like, why would they want to be involved in a career and technical student organization when they don't get to go on the trips or maybe to the conferences with them as well?
Good feedback. Great feedback.
Maybe try to find ways to, how do you keep involving kids in those clubs and activities with CT? That's a good point. Very good point. Great. Sophie, did we address the issues that you put in your chat, or did you want to add some additional comments?
Yes, I feel like they were addressed and expanded upon really well.
Good. Amy, I see you added one more comment there.
Yeah, I'm not really sure how feasible this would be, but I think I've heard that some school districts are extending their school day a little bit longer so that certain groups can come in the morning and then have classes, and then other groups can come in the afternoon, and that decreases the amount of students that's in the building and in classes at the same time. But like I said, I'm not sure if that's possible.
I do know of one district that's doing that. I don't know to what extent the remaining districts are, but I do know that there is one, and I've heard of another one that is considering it.
Okay. All right.
All right. Have any others?
I think I'm not sure if we have any other questions on that. Do you want to talk about the brand, or do you have any other follow-up questions, Tom?
No, the only other, no, I think unless just the driving questions that we had on there, I had one about transportation. I don't think we had any questions. But
I can put that back up there. Hold on one second.
but I think we've addressed most of the other ones without asking them. That's why I think it's a great group. So if you don't have any other questions about or concerns about it, we will move on to that. I know you all have a packed agenda today. And I think if some question comes to mind, you can put it in the chat box as we move forward too.
Hold on, I moved way too quick through the slides here. Hold up a second. There we go. I am going to share this back with you just so we can kind of look through them and have the students look through and see if there's anything else you'd like to add to the discussion with the chat, with the questions. Yeah, is there anything about the transportation question? When thinking about transportation from your home high school to a CTE center or an ATC, what concerns or questions might arise? Do you have anything to add to that? So Layla?
Hi, it's me again. So I think, sorry about this. Okay, I'm getting there. So personally, like, I come from a really big school district. I'm from JCPS, and I know this has been like a pretty big topic for my district because there are just so many students, and in order to like follow safety regulations, we'd have to have like multiple bus runs. And I think one of the major concerns, just from what I'm hearing from like other teachers and also like other families that are like part of my community, is that they're concerned about the timing of things. Just, well, one, they're concerned about the safety. I think that's like a pretty obvious go-to. But then another thing is that they recognize that it could possibly take several hours just to get students home there, and then also getting them back home. So students could get home very late, especially since schools are sort of expanding their hours, or like they have altered them just so that it's later in the day because people are used to waking up late now. But for the most part, I think like it could definitely affect sort of like family schedules, if that makes sense, and how like families are able to function because of like the timing of transportation, if that makes sense.
So the timing is the biggest concern there. Thank you.
Okay. Anybody else? Madeline.
Hi, yes. So I am in the Pulaski County School District, and our ATC center is probably 15 to 20 minutes away from our school. And normally we have a set time where our buses will pick up students from the school and take them over to the center. And we even share buses between other high schools in our district. And they've completely taken that away, and now anyone who wants to go to our area technology center has to drive themselves. And I think that is kind of, number one, concerning, because you have to have full trust in your students, to get there by themselves and get back to school. But also that really limits who can go, because of course not everyone drives to school, and not everyone is old enough to drive to school, and you can't ride with other students because of safety concerns, and they're trying to limit the spread of the virus. So I just think that's kind of an issue that we're facing right now, is how much use we're going to get out of our area technology center because of the limited amount of students who are going to be able to use it, if that makes sense.
It's a very good point.
Very, very good point. And in each of the ATCs, as you know, there's 51 of them. And there are, I think we serve about 120 districts, and each one of them are done differently. But I would like to research this particular instance a little bit more, but I think you're absolutely right. That is a concern.
Are any of you others experiencing similar problems with, or any issues with transportation? I know that we haven't been in school, or you all haven't been in school since March, but any other issues with transportation? Because these are things that we can maybe work out that with guidance documents and. Great. Perfect. Yeah, and I think you guys hit it out of the ballpark with the rest of these questions up on the screen. Yeah. I told you all, did I not brag on these kids? I said they were wonderful. So they are, well, and then one more thing we were going to talk about, and Leslie's just going to talk to you about briefly, which is pretty exciting for CTE. I'm going to go to the next slide. We're still kind of working on the final product of this. Oh, next slide, Tony. There we go. But go ahead, Leslie.
All right, guys. Again, good morning. We just wanted to take a few seconds to give you a sneak peek of some marketing and branding work that we're doing in our office. So just a little bit of quick background. Some of you may be familiar with the New Skills for Youth National Grant that Kentucky's been a part of for the last 3 to 4 years. And we've been one of 10 states engaged in that work. And so one of the final aspects of that work has been to create marketing and branding initiatives for CTE. So we've been really excited to build out a unified brand that we're going to use in a lot of media and communications moving forward. So you can see the logo that's been developed there, and a couple of things that we love about it. Number one, the word empowered is kind of at the core. And so we know that in CTE, we really want to empower students to pursue their passion and the careers that are going to, give them a fulfilling lifelong opportunity. And so the shading that you see as well on the logo is kind of intentional, because you see that the EM and the ED in the word empowered are kind of shaded a little differently. And that's to really draw attention to the fact that this is all about employment-driven education. And then that tagline, learning that works, is a great attempt for us to blend some old with new, because that is a tagline we've had in the national CTE world for a long time. Learning that works, meaning that it's engaging, it's contextual, it's hands-on, but that it's also preparing you for the world of work. So we also love this because, and it was not intentional, but the firm that we hired to do some of this work for us, when they came back with this logo, it blended beautifully with our KDE logo and our Team Kentucky logo. So the color schemes and everything are very much in alignment. So we're going to be using this logo and tagline moving forward in everything we do for Kentucky CTE. And specifically, we are calling on some of you. I know some of you are CTE students, and some of you may have a passion about CTE that you want to share as we move forward in our marketing and PR campaign. So we're going to be working on some print materials and advertisements. We're going to be working on radio commercials and even maybe a TV commercial or two. So I think when you have your exit slip today, you're going to have a chance to let Tony and all of us know if you want to lend your voice to that work. But we want to spotlight the work that's going on in our schools, and we definitely want to highlight great CTE students and advocates. So I look forward to working hopefully with some of you as we build out that marketing plan with this new logo. So I will pause there and see if you guys have any questions or comments. Tell us what you love, don't love about this new brand and logo.
Yeah, I'd love to see on a scale of say like 1 to 10, with 10 being the highest in the chat. What do you all think? I mean, we're still working on, we want to incorporate the Kentucky Department of Education in there some way. Yeah. So we're working on that, but what do you think about the Kentucky Empowered Learning That Works for CTE? What are your thoughts on that? Can you rank that for me in the chat, please? Sometimes it all comes in at one time, Leslie. Or am I muted? Okay, good. We're getting
okay,
some comments.
10. I think it looks great. Very professional. Awesome.
Good.
Great.
Awesome.
Yay. That's good feedback, guys. We appreciate it.
Yeah, and I will have it in your exit slip. Again, even if you don't want to be the quote unquote actors, I think there's going to be opportunities for you to write, write columns. There's going to be print campaign. We really want to put your voice, for CTE, and really talk about why it is important, and what we can do to highlight that. So great. Well, thank you, Leslie and Tom, for joining us this morning. And I just got a text message. We may have to move to our Dr. White is running a little bit late, so we might switch over to our next item on the agenda and then go back to Dr. White. So, but thank you all very much. Did you all have anything else you wanted to add for CTE? If you do, just raise your hand or let me know in the chat. If you can't raise your hand, and we can bring it up real quick.
Hey, Tony, this is Kelly. Can I go ahead and do my part of the Healthy at Schools?
Sure. Yeah, that's
fine. Or did Dr. White say when she was going to be able to join us?
She said she will just text soon. So do you want to just maybe go through, we can go through that PowerPoint, and then I think you could probably guide it, and then if they have questions, and then she can join in.
Sure, that would be great. I have posted, hold on, let me get my camera on here.
Oh, gotcha. I can unshare. Do you want me to, I'll share, or you got your camera on?
No, go ahead. You do the PowerPoint. I'll turn my camera off.
Perfect. Okay. All right.
Sure.
we are coordinated here.
Good
Hold
morning,
on a
everybody. My name is Kelly Foster, and I talked with you all a little bit the last time you met about the Healthy at Schools document, and I posted it in the chat earlier. And I'll go ahead and do it again right now, so it'll be a little bit. Oh, well, hold on. No, that's some other work I'm posting. Wait a minute. It is posted earlier in the chat. Tony, maybe if you can find that and repost it. They started talking. Here it is. Let me copy and paste this again. That way it'll be, oh.
And then do you all see the flagship document on the screen? The slide?
Yes.
Okay.
Okay, I am reposting here in the chat. So that link that I just posted will take you to the document that is on KDE's webpage. But basically, we worked with Public Health and Dr. White, who will be joining us shortly, to put together a document that was user-friendly, friendly for principals and teachers and students and all faculty and staff members and parents, but also covered all the great information that Public Health was sharing with us about what we need to do to open our school buildings so everyone could be safe. And so none of this guidance changed, even though we're going to wait a little bit longer to open our school doors for face-to-face. This will just give your schools a little bit more time to prep for that. So Tony has put some slides together about the Healthy at Schools document. And as you can see, it is in several different languages. I think we have 5 different languages that are posted on our website.
And this is just the perspective. These were Dr. White's slides. We were just kind of giving this rundown to all of the advisory groups. And since you all have not received this rundown, we can probably run through these slides pretty quickly. Kelly, did you want to just run through these?
I can go through them. It looks like that in late 2019, we weren't aware that the virus existed. And then it started showing up in Wuhan, which is a city of 11 million people. And then in February 2020, which seems like a long time ago, the virus started showing up in northern Italy. And then by early March, when I really became aware of the virus, we started seeing in the news that it was in Seattle, Washington. And so on March the 6th was the first day that a Kentucky resident tested positive for COVID-19. And the governor, Governor Beshear, declared a state of emergency. And then on March the 13th, President Trump declared a national state of emergency. And if you look at the numbers here in the next bullet, it says in March, modeling based on China, Italy, and other areas, the spread of COVID-19 could cause around 45,000 to 90,000 Kentuckians in death and nearly 2 million and nearly 2 to 4 million Americans, roughly 1 to 2% of our state and our nation in a single year. And I don't know exactly, I probably should, but I don't want to speak the numbers wrong. I don't know exactly where we are as total number of deaths in our state and our nation, but definitely scary times. There's no vaccine, there's no cure, and there's not really a treatment for COVID-19. When Dr. White gets on here, we better tell her she better watch out. I'm getting good at these slides.
You are getting good at these slides.
What's on the next one?
These are the reduction tools.
Okay,
when we were putting our document together.
Right. So this is very important, and you will see this in the Healthy at Schools document. And when you look at the Healthy at Schools document, you have expectations for school districts and you have best practices. And expectations are the things that are expected to happen. They are the requirements that need to happen in a school building for everyone to stay as safe as possible. So we have asked your school leaders, your superintendent, your district office staff, your principals, assistant principals, guidance counselors, family resource centers to really make sure that these 5 areas are taken care of every day in your building. So social distancing. So when you do go back to face-to-face classes, you may have fewer students in a classroom, your desks may be further apart, they may have worked something out for class changes. They may have certain hallways are going one way, and certain staircases are either going to be an up or down staircase to try to distance people. And if you've watched any of the national news, we saw some pictures of schools opening in Georgia, and they were not doing a good job of social distancing. It looked like a typical high school hallway where kids were everywhere and nobody was wearing a mask. So that's one of the things that we know that we can do to help prevent being infected by the virus. The other, number 2, is the cloth face coverings. And we are under a mandate by the governor right now in the state. If you are going to a restaurant or the grocery store, or anytime that you're out, that you need to be wearing the cloth face coverings. And so that's the same for schools. And so one of the agreements we kind of made with public health was, if you move, you mask. So if you're changing classes, or you're walking to the cafeteria, or you're going up to sharpen your pencil, or you're going to the restroom, anytime you're moving, you need to have your mask on. And there may be certain situations, if you're sitting at your desk and you are 6 feet away from other students, that you would have the opportunity to take your mask down for a little break. But for the majority of the school day, you will be required to wear a cloth face covering. And then screenings and temperature checks. There are a couple of things that your district can do. They can have your parents sign off when you board a school bus that they have taken your temperature and that you do not have a temperature above 100.4. And then there will also be temperature checks set up there at your local school. So depending on how big your school is, or if you drive to school, or your parents drop you off, or if you ride the bus, there will be checkpoints, maybe as you come off the bus or when you enter the building, to make sure that you do not have a temperature, because that's the number one way that we can really determine if people have the virus. Because you can have symptoms, or you could be asymptomatic and not have any symptoms, but still be a carrier of the virus. So the temperature check is extremely important. And then washing our hands. I'm sure all of you all probably remember from kindergarten where they talked about singing the ABCs or singing happy birthday as you wash your hands. So really encouraging everyone to make sure that for 20 seconds that you wash your hands with soap and water as often as possible. Carry hand sanitizer. And then we have released guidance to schools about surface hygiene, making sure that the buses are cleaned after each route, making sure that the cafeteria tables are clean, making sure that your desks are clean, making sure that computer keyboards are clean. So there will be lots of things in place that to ensure that we're really making an extra effort on surfaces. And then the contact tracing. They mentioned that in the CTE presentation. So when we do open to face-to-face instruction, we will be working with local health departments. So if a student at your school or a teacher at your school and was infected and was positive for COVID-19, then the health department would become involved, and they would want to know what bus the student rode on, and what seat the student rode on that bus, or what teacher it was, because you don't really have to quarantine. My understanding from public health is you wouldn't have to quarantine the whole school necessarily, or the whole bus, but the people that had been the closest to you, those sitting around you, or the people on the same seat you were on the bus. So that's going to be a really important piece of this. If someone does turn up positive, knowing who they've been around, so those people can quarantine and not spread the virus to others. So all of those are the expectations.
All right. And then these are just, again, these are just little slides, and you'll get a copy of the PowerPoint, because, I figured if you want to go through these or share with your friends or others in your district, these are the same slides that we have presented to the other advisory groups that just outline exactly what Dr. Foster just essentially spoke to you about. Really, it's just a matter of balancing, public health with the other concerns. And In putting together this document, we also know that we're going to have to update it. And in fact, we've already updated it one time already. Correct, Dr. Foster?
Yes, when you go to the link on page 6 of the document that's posted on our webpage, you will see some changes. And those changes are based on the recommendations from the CDC.
Hi, Tony. This is Connie White. I just jumped on.
Oh, great. So Dr. White is here. So perfect timing. So we were just finishing up shoot, I think I just went back to we were just finishing up there. So this is a perfect time and a perfect segue for students. If you have any questions for us at KDE or Dr. Connie White, as I mentioned, she's our Deputy Commissioner for the Department for Public Health. She works right with Dr. Stack every day. And is pretty much our liaison at the Department of Education. You know, we joke between her and Kevin that they both could have honorary doctorates in different areas, as well as Robin and Kelly, as much as they've done. So if you all have any questions about the Healthy at School document, go ahead and raise your hand, or you can talk in the chat, and I'll be more than happy to convey your questions.
And I want to apologize to the students in advance. I'm at Markey Cancer Center with my uncle getting his first chemo infusion today, so we're waiting. So I may just up and say, "Oop, gotta go." So if I do that, it's not because I'm trying to be rude. I just, when they call us, I'm ready to go. So
no worries.
Questions, I'd love to answer.
All right, Viviana, go ahead.
So under the document, under the return to school for other illnesses other than COVID, it said the requirements are fever and symptom free for 24 hours without fever reducing medication. And also it says that there's no, you don't need to present a negative COVID test in order to return back to school. So I think one concern that sort of came up with that was, how can we ensure that we're not allowing asymptomatic students back into the classroom if we're not requiring a negative COVID test, but also kind of contradicting that, kind of understanding that not everybody in our community would have the means and appropriate healthcare insurance to obtain a COVID test. So also how we can help that situation, not only as a school, but as a community, to make sure that we're really caring for our students, not just their education, but also their health.
That's a great question. Can you hear me through this mask? I'm talking through a mask right now in the med center.
Yes.
Okay, good. That's an excellent question. And originally that was a 72 hours with no fever. And I think the CDC, and right now, before COVID, that was the rule for most schools, the 24 hours without a fever. So I think the thought process was, if you've got COVID, you're not going to go 24 hours without a fever. Without using Tylenol or something to lower your temperature. So it's very unlikely that you're going to have COVID and then suddenly be afebrile. That's just probably not going to happen. And the other reason you're absolutely right is we have some parents that, number one, don't believe that COVID even exists. They would refuse to get a test for their child. And so those students would be penalized because they wouldn't have a test result. And also, as you said, a lot of them, even if they wanted to get one, would not have either the wherewithal to figure out how to get a test, transportation if both parents are working, or there's just one parent. Parents can't take off from work to go get a test done. We just felt like that would throw so many barriers up that would penalize the student body. So we're counting on the fact that if you have COVID, you're not going to have one fever check and then be afebrile for the next day. That's just not how the process works. So we're counting on that to be our protection for the rest of the student body and also for that child. Could be an ear infection, could be a cold, could be flu as flu season comes up. So that was the thought process, I think, that the CDC went through, and we probably reluctantly accepted that as a physician. I'd rather see 72 hours, but I also understand that that's a very impractical, and that's just me being super duper careful and in reality, 24 hours afebrile will probably weed out anybody that does not have COVID. Does that help answer that question?
Great. Anna, you
Yes,
have
thank
a,
you.
go ahead, sorry. Anna, go ahead.
Yeah, so my question was about a document in the email that you sent. I was looking through like the ratio between like a teacher and then students, and I saw that for high school, it put 1 teacher per 31 students. I was just wondering how distancing within a classroom would work with 31 students. I might have read it wrong, but I was just confused about that.
Dr. Foster, that's probably one of y'all's documents, I think.
So some of the guidance we just released was around virtual class sizes. And so you're
Okay.
right, a high school, it's a 31 students to 1 teacher. And so that is one of the challenges moving forward. So I think most districts think that probably some kids will stay virtual when we do go back to face. So some kids will stay virtual and some kids will come back to face. And so that means you might have fewer students there on campus. And so you would be able to social distance a little bit better, because instead of having 31 kids in your class, you may have 15 and you'd be able to spread out a little bit. So that's one of the challenges. I know one of the things that your principals have been looking at is, could we use the gymnasium? Could we use the stage? Other areas in your school building that typically don't house students for instructions. How can we turn those spaces into classrooms so we could be able to guarantee the social distancing? And that's going to look different from school to school based on how many students are there and how much space each building has. That's why the mask is so important, because you may not be able to have exactly the 6 feet between each person, and that's when you really need to make sure that you have your mask on.
And Dr. Foster, this might be a good time to talk to them about the hairdressers in Missouri. I think that's such a great example. When COVID first started in Missouri and they closed down the hair salons, as they have every place else, when they reopened hair salons, there were 2 hairdressers in Missouri who, unfortunately, not only were they COVID positive, they were also symptomatic, but they decided to ignore that and go on back to work. They saw between the 2 of them 150 plus clients in a week. And I don't know, I apologize, I couldn't get on Microsoft Teams on my phone, but I don't know what the ratio of males to females are in this group. But the females know that you spend a lot of time in a chair when you're with a hairdresser. Of those 150 plus people that saw these 2 symptomatic positive COVID hairdressers, the hairdressers wore masks the entire time, and all 150 plus clients wore a mask the whole time. None of those 150 plus clients became COVID positive. So that's a great example to me how wearing that mask and wearing it all the time can make a significant difference if we can't get that 6 feet social distance that we would prefer in a classroom setting.
Okay. Roheen, you have a question.
Yeah, so I know the importance of hand washing is emphasized, but is there anything being done to ensure that those surfaces are clean? So are like the sinks and the soap dispensers going to be sensor based, or are they like still physical? So you have to touch them.
I think
And
you're
Tony and Dr.
asking.
Foster, yeah, I know y'all have got some specific documents about that.
So I think you were asking, is there a way to make sure that the soap dispensers have been cleaned, or we don't have to touch them like they're automatic? And I think that's what you're asking.
Yeah.
So yes, we have provided guidance out to the schools about what type of cleaning supplies they need to purchase, stronger supplies than normal. So, I don't think every school is going to be able to get all brand new hand sanitizer dispensers or soap dispensers that are no touch, because they probably don't have the funds to do that. But we have provided them with specific guidance about what supplies that they need to buy to purchase in order to make sure that everything is as clean as possible. That's a great question. And that's why, if at all possible, you probably need to carry your own hand sanitizer, even after you go to the restroom and wash your hands and everything. It doesn't hurt to put a little hand sanitizer on afterwards.
And I guess also too, Dr. Foster, the frequency of cleaning, we've also included in our guidance documents too, on how often the school should be cleaning and when, like between class changes and such. Anybody else? Let me look in the chat here.
Tony, I see a good one for Dr.
Okay.
White in the chat on false negatives. Dr. White, could you talk a little bit about that? I think the students have concerns about how many false negative tests are out there. Is that an issue?
Well, it can be, and it's you know, I'm so used as a physician to having answers, and I've gotten very used to now saying, one, I don't know, and two, it depends. And this is one of those, it depends. So if you are going in for one of the rapid tests, and the rapid tests are not the gold standard. The gold standard is the test where they place the like I just said yesterday, the Q-tip goes up inside to the base of the back of the nose. That's your real gold standard. If you're going in for a point of POC or a point of care test, if you are symptomatic and you get a negative, that could be a false negative. So if it's positive, if you go in symptomatic or not and it's positive, then you probably are positive. But if you were to come into, if I had an office again and you came in my office and you were symptomatic and I did a rapid test on you and you were negative, man, I would then suggest that we go on and do the PCR test, it's called, which is the test that goes up into the back of the nose, because I would be concerned about a false negative there. There is a real discussion in the public health world. If we get more testing, and one of the suggestions, and I know there are lots of companies working on this, a test that you would just put in your, like a piece of litmus paper you put in your mouth and check yourself every other day to see if you're positive. The results of that aren't quite as accurate as this test I'm talking about that goes back in the back of your nose. The problem is you can't, one, get people to do that test because it does burn. And number two, we don't have a lot of those tests. So you have to balance, do you do a test that's more accurate but only tests fewer people? Or do you do a test that's less accurate but you're more likely to cover more people that way? And that's where we are right now with our testing. We are truly developing the testing on the fly as we go. And more in the next 3 months, I think we're going to see a tremendous array of new tests that will be point of care testing, maybe not quite as accurate, but if you can do it frequently, then you're going to catch people that are positive. But the false negative, yes, I lose sleep at night worrying about that. Are we missing people that are positive? But I think if you follow that rule, if you've got symptoms, I would probably go right to the PCR test and not even do the point of care, just so I'm sure I've got the right answer.
Okay.
Does that help answer that question?
I think so. Sophie, you've asked a great question in the chat, and several of your teammates have asked. So I'd like you to go ahead and turn your video on and go ahead and ask.
So one thing I was curious about is guidance on how to handle discipline with non-compliance, because like if you have a high school student and they just say that they're not going to wear a mask, you can't physically make someone wear a mask. So what sort of guidelines do you have for enforcing discipline? Because it's not as easy as like, oh, if a student's misbehaving, like if they're misbehaving in this case, they're kind of putting everyone at risk. And so what's the guidance to make sure that teachers are safe while they're disciplining, and that but also you're like enforcing mask wearing and social distancing?
I can give you the public health answer, and then Dr. Foster can give you the education answer. Public health, we try very hard not to enforce a bunch of rules. We try to educate and inform people and try to make them understand why we're asking them to do what we're asking them to do. But I do, from what I understand, that we're thinking of the mask as part of the dress code. So you don't come to school without a shirt on. You don't come to school dressed inappropriately, and not wearing a mask would be inappropriate dress. I actually went to to pick up some carryout at a restaurant last night here in Lexington, and there was a sign on the door that said no shoes, no shirt, no mask, no service. So I think we think of that in the same way in the school system. So then I'll let Dr. Foster answer, if you educate, inform, cajole, beg, whatever the word you use, and you can't get compliance, is that someone that you can put on virtual? I don't know the answer to that.
So
See, I'm
Sophie,
getting
that's a
good
great
at saying I don't know. It's a great question.
That's a great question, Sophie. And so what we have been messaging to your building principals and to your superintendents is that they need to create a culture and climate of safety. And this is the expectation to wear a mask because of health reasons and because of the virus. So we've really that's how we've been trying to gear the principals to have like a social media campaign, and you've probably seen that on Twitter. Many school districts are showing people, and the governor has started a campaign, and you've seen famous people speaking out about how important it is to wear a mask. We don't want not having a mask to become a discipline issue. We would rather that the administration of the school try to work with the students to educate them about why it's so important to wear a mask. Now, I will say if a school wanted to adopt a site-based decision-making policy, where just like Dr. White kind of talked about it as part of the dress code, they could do that. But the first option is really to try to educate the student and help them become aware of the health reasons for the mask. And then if that's not working, it could become a discipline code, a dress code violation, or maybe there needs to be a conversation about if you're not going to wear one, then let's look at virtual school for you.
And I think just to pipe in here, this is really a great opportunity for you all as student leaders in your schools to take the guidance just like we've given it to your school leaders, and and share the importance of the mask wearing. I know we talked about this last week, and we're going to show some of the projects that you were working on, but really to just to share the importance of wearing masks, and hopefully people will model what other people are doing. It does seem to me like when I'm out and about, and I'm in Jefferson County, that more people are wearing masks than they were a couple of weeks ago or even a month ago. But amongst students, I have an 18-year-old son myself, so I know it's different with teenagers and kids. So I do think that I think that you all have a role that you have an important role that you could play as well. All right. There's a couple other questions.
And that's critical. And I think the other way you look at it is this mask is what's going to get us out of the house. I heard one of the board members for the Lexington Board of Education who said he has 4 children under the age of 10, and 3 of them are special needs. And all 4 of his kids wore a mask every day at the YMCA camp this summer because they knew that was going to get them out of the house. And so even the special needs kids understood that and were compliant with that because they wanted to go to camp. So if kids want to go to school, and you can't imagine how important your presence, your influence will make on your peers. It's more than you can ever even imagine. As I look back, I know I went to school in the dark ages, but it's critical, and you're such an important part of this whole process.
Great. Cade Scott, are you there? I know you said you had a question and would like to speak.
Yeah, so my question is really about that. I had heard that masks can be treated as dress. So with the punishment and stuff, at Floyd Central, if you violate dress code, you're either provided new clothes from the resource center or you're sent home. So if there's a student without a mask, will the schools be trying to provide them with the masks? Because if so, that could speak to the mask drive that we're talking about. I mean, or otherwise, if the school doesn't provide masks, will they be sent home?
No, the school's going to have masks. They are available for students that don't have one. I mean, let's be real. Sometimes you may just forget yours on the bus or at home or in the car. So that is something, there's a donation campaign that the Lieutenant Governor is leading about trying to get people and organizations to donate masks to schools. And then the schools have also received some additional federal funds for the reopening of schools to make them safe. And so local school districts will have masks available for kids that do not have one.
And again, that's another great campaign for you folks to do, because, you know, if we had kids in our school making purple and gold Campbellville Eagles masks, then everybody would want one. And they're so simple to make. It could be a nice campaign for the students to feel like they're providing for each other.
Absolutely. And just even Dr. White, several of them are wanting to participate with the Coverings for Kids initiative,
Right.
and trying to, you know, help with their schools, take that, you know, the burden off, you know, the collection points. So perfect.
Right. Great.
Got a couple more questions. Layla Hayes. Layla?
So this question regards mask wearing. Hello, can you hear me?
Yes.
Okay. So my question regards mask wearing. There's been research that's come out about the most effective masks to wear. And I was wondering if the guidelines would address that, because some researchers say that like some certain types of masks are worse than not wearing a mask at all, such as like bandanas and stuff. So I was wondering if that would be addressed.
That's a good question. And the best I've seen is there's a video, and I wish I had flagged it so I can find it again. But it was a video that showed the spreading of droplets when people didn't have a mask on, when they had just a single layer bandana on, and then when they had a double layer cloth mask on. So I don't know about it being worse than nothing at all, but the single layer bandana didn't do a lot of protection. So if you're going to do a bandana, it definitely needs to be a double layer, because just 2 layers of cloth versus 1 was just exponentially better at protection. And so I would encourage that whatever you do, you make it a double layer. I know some of them have pockets in it to put a piece of filter paper that you can do if you are that industrious. But the double layer is the critical piece. And then I think getting those ear loops that are comfortable for you to wear, so it holds it up against your face. It's not going to be tight like a surgical mask, but it will give you better. The more you can keep your droplets in the mask, that also means other people's droplets aren't getting into the mask and getting to you as well.
Okay. Anastasia?
Hi. So I know for some schools, like the dress code says like bandanas aren't allowed. So will that change a little bit for now, being under the circumstances that we're in?
So Kelly, I think that I was gonna say that probably goes to a local school board.
Sorry, I was actually reading something else. Could she repeat that?
Sure. Go ahead, Anastasia.
So for like some schools, their dress code, they don't allow bandanas in schools. So under the circumstances that we're in now, will that change?
So each local site-based decision-making council, they're the people that, you know, pass the dress code. And so they would need to, you know, if they're going to be okay with wearing a bandana as a face covering, they would need to amend their dress code policy.
And then I have one more question.
Okay.
It's about the safety document that was shown. So for people with seasonal allergies and like coughing and just like sneezing because of their allergies, how will that be affected, like if they attend school?
Well, that's why in the list of symptoms that we put, initially we said coughing, and then the CDC came back and said you need to say a new cough, because those of us with seasonal allergies, people with chronic asthma, are already going to have a cough, and we certainly don't want to send people home every day they have a cough if this is a chronic medical condition that's known to them. So on page 6 that Dr. Foster talked about, that's one of the changes that we made, was that it needs to be a new cough or a new sneeze for you.
Okay, thank you.
Uh-huh.
I did see Roheen. Is your hand raised from before, or did you have another question?
Oh, sorry, my hand was raised from before.
Okay, that's fine. I did want to check in with Elizabeth. And our interpreters. Elizabeth, did you have any questions? If so, just let me know in the chat box. I want to make sure I'm not missing anything there. All right. I think that I've reached everybody unless I have missed a message here. Let me go back in the chat box. Let me see. Thank you, Elizabeth. Okay, great. Well, this was a great discussion, and I really, Dr. White, I so appreciate you taking the time out. I know that you had to go and do a personal thing this morning, and that you still made time to come talk with our students, and I know that they really appreciate that. So thank you so much.
I've heard Commissioner Brown brag on this group so many times. I did not want to miss an opportunity to be a part of this. Thank you. Thank y'all for what you do. It is so important, not only for your peers, but it is so important for the Department of Education to have your voice. I mean, they truly rely on you. They say that y'all are tougher than the other advisory groups that the commissioner has to work with. And so good for you for keeping the adults honest and keeping them real. And I just can't thank you enough for all your work and being a part of this. And Tony, thank you, and Dr. Foster for allowing me to be here today.
Absolutely. We might have to invite you back. They might have some more questions for you.
I would love to be back anytime.
Thank you.
Okay, I'm gonna jump off then. Bye-bye.
Bye. All right, so we're a little bit behind on schedule, but that's okay, because again, we want to make sure you get all your questions answered and you're able to provide feedback. Our next topic is we're going to go into the Library Media Center guidance, and I'm not sure if Ben is here or if it's going to be James Allen, who is here from Library Media.
We are both here.
You're both here. Fabulous. So let me go ahead and I will share the slide and get that up for you.
And while you're doing that, Tony, just wanted to say, I think this is one of the most exciting things I've gotten to do in several weeks. This group is really awesome. I know Dr. Park and I were having to kind of divide and conquer, and he was able to get the task force yesterday, and I was able to get the student advisory today, and I think I drew the tougher crowd for sure. But no, this has been great. We're excited to be with you today. Just real quick, James and I work on a small little ninja squad that we call the Digital Learning Team inside the Office of Education Technology. And so we are in pretty high demand right now, as you might imagine. And so we have been involved in quite a few of the projects that you're hearing about in one way, shape, or form. But some of the things that I do, and I'm going to let James introduce himself quickly, but just quickly, I'm a former teacher and middle school and elementary principal. I'm a father of 2 public school kiddos, one going into 6th grade. So if you have any advice for me, or you remember your middle school days, please let me know. You can email me. And then one going into 5th grade. And so we're definitely looking forward to this year with even though there's a lot of things up in the air. And so we did want to take an opportunity to kind of discuss with you one of the things that we work with, and James specifically, is our library media centers and our library media specialists. So he's going to take an opportunity to kind of go through some of the guidance with you. And then we have some questions, and Tony, I'll pop those into the chat window while he's discussing this. And students, that'll give you an opportunity to kind of look at the questions and start to formulate some ideas. And I know we're a little behind schedule, and so that may quicken the discussion as well. So James, take it away, buddy.
Good morning. Yeah, like Ben was saying, we do work on everyone on our team is a digital learning coach, but we all kind of have our own areas of expertise, I guess. So mine is a school library. I've been a school librarian for about 18 years. This is just my first year at KDE, so it's been really cool working with all the librarians we have in our schools around the state. There's a little bit over 1,000, I think, so it's quite a few people. I will go over these. We put these slides together. This isn't the actual guidance document, so it's not. The actual document has a few more things in it. It's on the website that I think I forget who in the beginning. It might have been Tony who showed you in the beginning the COVID site and how to get to those links. So that's there. But this kind of just breaks it down into a little bit bigger chunks. So some of it will just be really for your school library staff. It's kind of like how to take care of the library and keep it clean, and kind of like things you've seen in the store where there's, you go a certain direction down the aisles and signs and things like that. And then the rest of it really focuses more on kind of reminding schools and librarians and teachers and students what your school librarian can actually do for you. It's not just going and checking out the books. So we'll look at this slide right here. So probably some of you are in schools and districts that have access to KYVL, which is Kentucky Virtual Library, and a lot of schools use that in different ways. It's also something that public libraries use, so you might be familiar with it there also. And then KET and PBS Learning Media, your teachers might use those resources a lot. So in our team that Ben and I work on, we really work to help teachers have access to high quality content for their classes. So that's kind of what part of this document is, just to remind folks in your schools, and especially new teachers, teachers that haven't been doing this as long may not know all the resources that are available to you all. So this will kind of help them out. And then especially with the announcement yesterday and possibly schools, waiting a little bit to go back in person, having access to ebooks and audiobooks, because as you know, librarians are very passionate about reading and promoting reading to you all, and not just, assignments as reading, but you all getting to choose what books you want to read. So that's really important to librarians, as you all having choice. So them being really focused on providing electronic versions of that during this time is really important to us. And the next slide, I think, sorry, I've only got my one screen today. There we go. Yeah, like I mentioned, the reading promotion. And then in the spring, we do have a few questions for you, but the spring was kind of a crazy time, and we did really the best we could, probably all of your schools did. And we try not to overwhelm you, try not to overwhelm your parents, but we really want to make sure this fall we maintain relationships with students as library media specialists, because sometimes you don't get to see students as often as you would if you were an English teacher or a math teacher. So it's important that we kind of keep connected with you all and what you all need and what you need help with. And then the last part of this kind of talks about things you all have probably seen before, what your school librarian does to help you out in a regular day. And especially at the high school level, usually those places are a little bit more flexible, and those people are available to you pretty much the whole day. And I would try to keep in mind and remind your friends that your school librarian is available anytime you need help during the school day, and sometimes after school and before school. So, all right.
Okay, guys. So I will stop sharing the screen, and the floor is yours. The discussion questions are there in the chat. If you want to go ahead and raise your hands, if you want to, anybody wants to just tackle any of the guiding questions in terms of dividing the perfect media center. Oh, it looks like Miles already is jumping in. Go ahead, Miles.
I would just like to say, I'd like to answer question number 3. And pretty much what I want to say is that, I want the media specialist to kind of be like another source, to kind of be very familiar with the software that we use. So whenever we have a problem with the virtual learning academy, we don't always have to go to our teacher, but we can also rely on you guys as another source if we have an issue.
Yeah, that's really important. And like I was mentioning, on the team that Ben and I are on, we're all digital learning coaches. So a lot of schools rely heavily on their librarian to be kind of that person you do go to for technology help, regardless of regardless of virus time or not. So yeah, and you may not have that relationship with your librarian, but I have a feeling that person, even if they're not an expert at what you need help with, they're still going to be able to get you in touch with the right person and quickly. So I really like that point you brought up. And before anybody else, I want some others to speak, but I really appreciate this time, because I'm going to share this with all the librarians I work with around the state, and this will be really helpful for them as you share. Thank you.
Okay. Another question. Lauren, go ahead.
Yeah, so will there be specific guidelines for checking out books or using computers in the library media center? So I feel like that might be something that needs to be addressed.
Yeah, in the guidance, we do recommend that, one way that you could limit contact with people, kind of how we listen to the governor give his talks, like just anytime you can kind of limit contact is good. So I would say, I would almost go as far as guessing 100% of you have catalogs that are online. So you're not having to go to the library to browse which books you have available. You should be able to do that from definitely in your school, in your classroom on a device, but many of you can probably do that from home too. And if your school librarian does not have the ability to let you place holds, I'm sure it's something they're working on. So what some schools I've heard about, I think one in particular is maybe Henry Clay High School in Lexington. Their kids are putting holds on books and then actually picking those up like curbside, like some public libraries are doing. So if your school librarian is not doing that, they're not going to be offended if you give them that idea and say that would be awesome. So yeah, definitely using that online catalog will help you be able to tell what books you have.
Okay, Caleb.
Hey, can you hear me?
Mm-hmm.
Okay, all right. So I'm going to answer a couple of different questions and just raise some general concerns that I have. Given that a number of students won't return to in-person instruction until, as of now, September 28th, some students may not even return at all. So our school places a huge emphasis on reading intervention and working to, raise test scores, the MAP test scores, ACT test scores, that type of thing for students. Personally, I worry that, offering those services online will be difficult. I would love to see our school media librarians work to provide books and that type of thing, of course, to young people throughout the state to help keep their reading abilities on track so that they don't backslide while we're not actually in school. And then also, as you mentioned, I think that our librarians could serve as a great resource when it comes to helping with technology needs, to helping with, using different types of online platforms, including Microsoft Teams for students who decide to do synchronized learning, and just being there to generally answer questions as they come up and as they arise. And so, yeah, that's pretty much all that I wanted to add. Thank you.
No, that's really good. What I've been suggesting to my peers is that this is all kind of new, right? We've all had some, Google Classrooms and online platforms before, but there's been a lot of times where we haven't done that for long periods of time. So like in a regular school day, I might be available to come to your classroom and talk to you about resources for a certain project or an assignment you might have. But what would really be awesome to me is if your librarian would be also a teacher in your online classrooms. So they may not be there every single day and commenting on every single assignment or project, but they're there in case you need to reach out to them and they can see your questions right away. So your librarian may be doing that. If they're not, that's fine too, but just know that they're there. Then you can, I would assume email is probably the easiest way to get in touch with any teacher in the building, and that's the same for your librarian. So thanks for those comments.
I'd like to go to Gracie. She has a really good point and brings a very different perspective for our students at the School for the Blind. Go ahead, Gracie.
So this only really probably up to me at all, but I go to the School for the Blind, and a big concern I have is a big portion of kids I go to school with, including myself, read Braille, and Braille can literally only be used through touch, and you can't always disinfect them because it's paper. And another thing is there are audiobooks, of course, but a big portion of the audiobooks we check out different devices and cartridges to listen to the audiobooks, which, again, you have to disinfect all of that. So I was just kind of concerned about that.
That's a good question. So in the guidance document, there's a link at the, I think it might be the very last link actually in the document. There's some research that an organization has done specifically for libraries and museums, and they took typical, kind of surfaces that you would have in a library, anything from DVDs to book covers to magazines, and they did some tests to see how long the virus would stay viable on that surface. And the longest was 4 days. So even if it was I'm kind of thinking like a Braille book where you would be touching the pages, it would, if you kind of quarantine that book for at least, I would be safe in say a week, it's going to be pretty safe to use again after that. So, and I've actually visited your school, which is awesome. I've seen your library. I actually used to work with Miss Unker, your librarian. So I know she will do everything possible to keep you all safe and make sure you have things to read. But I really appreciate the perspective, because other people need to know about that too, like especially that touch part, because that's a real thing.
Great. Thank you, Gracie. So Renuka, go ahead.
So I was just thinking that, like, especially given the certain COVID circumstances that we have right now, that it's really important to, oh, my camera isn't turned on, sorry. Yeah, so that it's really important to, have the AP testing resources and, just college entrance tests, so like ACT and SAT. And just in general, many school libraries, they lack these resources for college entrance exams, and they're really important, especially now when they'll be needing the resources more than ever. So I think that's just something to consider when creating this library media center.
That is a good point. If your school, not every single district in our state is a Kentucky Virtual Library subscriber, but if you are, they have tons of testing resources inside of KYVL. And if you're sadly not one of those school districts, probably your public library is a member, and you would have those resources from your public library. So you can actually go on and take practice ACT tests. There's lots of kind of like interactive tutorials that'll help you prepare for the test. So if you're looking for that kind of thing, or your friends are, don't feel bad about reaching out to your teachers and your librarians and asking for help getting access to that on KYVL or another place.
Okay. Gavin, did you want to add any comments, or were you just putting that in the chat?
I was just kind of throwing that in there.
Okay. All right. Does anybody else have any comments or things that they would like to share with our library media specialist?
Or questions about the guidance, or anything really.
And Tony, while some of the students are kind of formulating some thoughts, or Gavin, your comment is really good. Like, if you're not aware that your library, your media center has access to resources, they may have those, and they may not know about them. And so that's something that James and I can follow up with them. Like the KYVL opportunity is a great example. And there's some other resources that we curate that we can absolutely share with them. But also too, it may speak to just a gap in communication between the media center and where you guys are living, for your learning experience right now, whether it's Google Classrooms or Schoology, through your LMS and things. And so if there's a way to share with us, the district that you're with, we would be glad to. There's a great chance James may have already worked with them or know them, but we can also follow up to make sure there are some resources available, and that they're aware of specific ones that they do have access to, that they can get to you. So
we can share those with you. Sorry, go ahead.
Perfect.
No, it's sometimes it's like everything that we do, right? Communication can sometimes be difficult. Like, you all are busy with classes, your teachers are busy teaching those classes, your librarian's busy they may be teaching classes, they may be sharing things, and sometimes it just is difficult for teachers to keep up with even like the things their librarian shares with them and then pass on to you. So it may not be like they're trying to keep it from you. It's just, sometimes it just gets left out, but definitely reach out and we can help you with that.
Good. And then in your exit slips too, we will absolutely we're gonna, as we do with all of the sessions too, just to, because we always want to take a temperature and see how these different areas are doing, because we do want to use your feedback and be able to be constructive and take it back to our areas and see how we can make improvements. So
yeah, and hopefully
absolutely.
it doesn't necessarily have to be about the situation we're in right now, right? Hopefully this virus thing we're going to be able to get through, and like I would love your feedback just on libraries in general so I can pass that on.
Sure. Sophie, go ahead. You have a question?
So I know that there's some programs and services that my library offers, but it's only like you can only access it for free if you're logged in with like school Wi-Fi or your school account or on a school computer, and with not every student being able to physically be at school, at least at the very beginning of the school year, like is there going to be a way to make it so students can still access those services when they're at home and not on school Wi-Fi?
That is a great question. I know specifically, let's use KYVL as an example, right? It knows that you're at school, so you don't have to use a username and password, which is great if you're at school. But if you're not at school,
Nope. Did we lose them?
Actually.
Oh, there we go.
So that's definitely something your librarian can give you to use at home. Oh, I'm sorry. Am I cutting out?
You're cutting out just a little bit.
Yeah. So your librarian should be able to help you with the KYVL part. If there's other products you all use, that may have to be like a specific question for that thing. But I feel like there should be a way to answer that for you though.
Okay. All right.
Sorry for my internet.
No, that's okay. That's okay. Anybody else? Any questions? Any comments? All right. Ben and James, thank you so much. We appreciate you coming and joining us today. We'll definitely invite you guys back and share the feedback from the exit slips. There are a couple more comments in the chat there, and go up for there and go from there. So we appreciate that. And we'll move on to our next item on the agenda and see if they are here. Thank you so much. And is Catherine and Blake, are you guys ready?
We are here.
We are.
Perfect. All right. Let me go ahead. Are you guys seeing my screen?
Yes.
Perfect. All right.
First, hello, everybody. I'm Blake Connie, and I work for KDE in the Office of Continuous Improvement and Support, but more specifically, I work in the branch of Safe Schools. And Catherine, want to introduce yourself?
Good morning. I'm Catherine Tillett. I'm working alongside Blake, and I've been involved in a lot of our statewide efforts to support student mental health, address trauma, and that is inclusive of suicide prevention, which we know is an important thing to attend to at this moment, always, but also at this moment.
And I will say, out of our office and branch, we address bullying, suicide prevention, PBIS, which is positive behavior and intervention systems, social emotional learning. Catherine handles our AWARE grant, so does a lot of resiliency trainings throughout the state. So for time's sake, we are going to cut a few of the slides out and really get to the meat of the discussion, because honestly, that's the main reason we're here, is to get feedback from you all, the advisory committee. So the questions we're looking at is how can we improve our current resources for suicide prevention, especially during this time, and what more can we do to support staff and student mental health.
And I went ahead and put those in the chat, so those will stay there even though the slide's going to move.
Thanks, Tony. All right, you can go to the next slide. Essentially, there's a lot of words there, but we're talking about this because suicide is the second leading cause of death amongst young adults. So at ages 10 to 24, we've seen an uptick in suicide, and like I said, it's the second leading cause of death amongst our student age population. You go to the next slide. Even among 10 to 14-year-olds, we've seen an uptick in suicides. In the last 10 years, there's been a tripling nationwide in the number of successful suicides amongst really some of the youngest students that are tracked. And so again, that's extremely alarming. It's something that unfortunately we shouldn't even have to monitor, but we do. Thanks, Tony. You can go to the next. This is the KRS, which is the requirement that by September 15th of every year, every public school provides training through video, live streaming, or in person to all students grades 6 through 12. And so that is the kind of the bar, is we have to provide this training by September 15th. And so I think this came up a couple weeks ago when you all spoke to Dr. Damien Sweeney. It needs to look different this year. And so KDE is in the process of putting out a new program that will support or recommendations for support in this area. But I wanted to ask you all, who has seen their school go above and beyond kind of that minimal requirement of providing training? And I'd just love to hear some of your all feedback on this and what you've seen as successful in your schools. Lauren, thanks for sharing that in text in the chat.
I'm just going to help just for our other students. Lauren, I don't know if you want to share, but just saying that schools not providing many resources for suicide prevention, feeling that we need to acquire more resources for students whose mental health has deteriorated due to the coronavirus. Sophie, did you want to share why you think your school has done a very good job?
Yes, I'm kind of in a unique situation because I go to a smaller school and it's a residential school. It's a Gatton Academy. And so one thing that they've done that's been really, really helpful is all students can set up appointments with our two mental health counselors and have like a 30-minute session to talk and get help and resources if you need it. And then also they do things like hold different sessions to talk about different stresses that we may have, and they can like contact people and the rest of the school to get you like academic help if that's what's causing stresses, or they can and they also give us like they have like little puzzle pieces that have all these sort of like different hotlines and stuff that they gave to all of us at the beginning of the year. So we could have that. And then one thing that I think is important that they do is they continue the conversation throughout the whole year, so it doesn't feel like it stops at the beginning of the year.
All right, thanks, Sophie. That's great.
Yeah, I want to offer also that sometimes suicide prevention doesn't look like a focused training where you're going to sit down and talk about suicide. That may be part of it, but programs like Sources of Strength, which is offered both through KDE and through our partners at the Department of Behavioral Health, is really focused more on peer support. There's an informational component to that as well, but peer support and knowing how to be an upstander. So sometimes it's really more about intentionally focusing on positive student relationships, positive school climates, with the end result of suicide prevention, because you're supporting everybody's mental health.
Caleb, go ahead.
Okay, thank you. I just wanted to say that, you know, our school does provide a few resources here in Breathitt County. Our counselors are always available to help if we need them. We have roughly 900 students in our school, grades 7 through 12. And our mental health professionals are there if we need them, and if one might be tied up with a student, there's another one there to help keep someone available at all times. I would love to see in our school, though, a greater emphasis placed on mental health awareness and on suicide prevention. I know that our training has not been as in-depth as I personally would have liked for it to have been. I would also like to say that I had been talking with my principal about, and when the previous speaker spoke about sources of strength that sparked this thought, I've been talking with my principal about us possibly implementing a sources of strength program or a green dot program or a program of that sort to help change the culture at my school, and to have hold overall discussions surrounding mental health that I think would move our school in a better direction. I think that a lot of times the conversation surrounding mental health really only sparks after a disaster occurs. And I would like to see my school place a greater emphasis on prevention rather than on helping after something occurs. And I would also just love to see my school develop a greater sense of community, and also to develop a greater network of people to help when issues arise. And I just wanted to add those comments. Thank you for giving me the floor for just a minute.
Caleb, that was awesome. You covered a lot of great points. Thank you.
Great. Anna, did you want to speak?
Yes, I can. Well, for me personally, I feel like it's really daunting for students to actually go to the counselors if that is their only resource. So I was just wondering what the training is exactly, and how the awareness will come to the students rather than the teachers and staff presenting it to the students.
So Anna, your question is on like for this year. Are you saying how is the training going to look? Okay, great. Yeah. And we will actually get to that in just a little bit, and I'll share the link to that training and what the recommendations are. Really, schools can use anything, but KDE does put out some guidance as to what the options are, along with the behavioral health and developmental of intellectual disabilities. All right.
So we'll get back to Anna's question when we get to that slide. Jack, you had your hand up?
Yes, ma'am. So this doesn't really answer the question because I think that my school is not very consistent with it as it goes into the summer. I don't remember who said something earlier with it stopping at the end of like the beginning of the school year. I don't remember who said that, but it kind of goes along with that. I think that I know at Marshall County we definitely had one successful suicide, one attempted suicide, and we had one back in the spring. And I think that we really just need to keep that consistency all the way through the school year, and then even some into the summer, to where we have teachers either checking in or just having different people check in on students everywhere, especially in rural communities where they're isolated a lot more than people that tend to live in the city where I live in.
Thanks, Jack.
Thank you, Jack. Viviana?
So I just kind of wanted to bring up a point that I've been concerned about. Obviously, COVID has brought students like a different kind of stress into their lives. But also, I think it's really important for school administration and counselors to bring up the topic of race-based stress and trauma, especially given these past few months, and definitely how traumatic that can be for students of color. And I think that's like understandably they're hard conversations to bring up in general, but I think it's really important for counselors to kind of reach out and kind of like support the idea of talking about it and not treating it as like something uncomfortable to talk about, but something more natural, and kind of make it a culture to be okay with speaking about it and how that's affecting the mental health of students as well.
Thanks, Viviana. Can I offer that that what you're saying is really, really important, and it's new territory for a lot of our adults, and it's hard, just like it is for kids sometimes. So one of the best resources out there in the world that I've found is through teachingtolerance.org, where they will have guided discussion prompts, self-reflection activities, both for students and also for teachers and other educators. So I strongly recommend looking at the resources on that particular site. But what you're saying is really critical.
Thank you.
Tony, if you want to jump in. Looks like still Layla.
Hi. Yeah, I mean, I think some of the points that many of you all have already shared is like have been amazing. One thing that I just wanted to add on was that, so like I think Sophie brought this up. She mentioned how like there are already resources that have been available for her school, and I think that's awesome. One thing that I just wanted to add on was like if we could create the chance for like students, not just like, I mean, it could be just school based, but if it could be like statewide, that would be even cooler. But have like the chance for students to be able to have like mental health focused interventions, and that could include like guided discussions, just like Viviana had brought up, but also like, and that, I mean, it doesn't have to be just about COVID, but it could also be about like any type of like gun violence, or something that my district has been discussing a lot is like having SROs, which are security, I can't remember what it is right now, but they're student resource officers. That's what it is. And it's basically like an officer that would be in school and would be armed just for any case of emergency. And that has been something that has been like a huge topic that has like sort of had two very different sides, if that makes sense, of discussion. So I think like even having the opportunity to have like those guided discussions, but also, I mean, you could have like some sort of yoga or creative art or writing like intervention, if that made sense, which that is something that my school was actually doing in March. We were having like mental health March month, and we never got to finish it because we just went to NTI. And so by having these opportunities for students just to be able to like let go of something or just like focus on something else, it could help the students be able to sort of relax, refocus, and become more engaged with, I guess, their feelings, but also maybe relieve some stress so that they can focus more on academic struggles, or even discuss that. That could be one of the resources that they have. And then last note, one of the other things that I found really helpful for me personally was that specifically my math teacher, she would have these like Google forms, and she would send, for me, she would send, or for our class, she would send them out every day. And I'm not, and pretty much she would ask like academic based questions, to make sure that we understand things, but also she would ask like, how are we doing emotionally? And I found that was very helpful for me and for some of my other peers, just because it helped her like stay aware of what was happening with her students, and also it helped the students feel listened to. And I mean, you can't necessarily tell whether or not a student is having an off day through a computer screen as well as you can in person. So I think that's something else that if teachers can like implement into their schedule, then that could be really helpful for some students across Kentucky.
So Layla, that was awesome. Really sounds like you had an awesome teacher.
All right, thanks guys. Let's see if we have some more, any other hands raised that I'm missing. I think we're good. We can move on to the next slide. Blake, are you ready?
Ready.
All right.
And if you want to jump to actually one more slide, we'll skip this one.
Okay. This one?
Yep.
Okay.
So this graph shows students that reported suicide attempt and whether or not they felt like their bully harassment policy at their school was effective. And so every student that shows up on this bar graph attempted suicide. However, 10% felt like their bully harassment policy was effective. 17 reported that it was not effective. And so this is very significant because it shows that students that felt like they had voice and there was a way to report were less likely to attempt suicide. And so if you can go to the next slide, Tony. All right. Catherine, do you want to ask this question? This is something that you are passionate about.
Sure. And I want to first share that this is research that's coming straight out of Kentucky through our Kentucky Incentives for Prevention survey that's administered through REACH Evaluation and the Department of Behavioral Health. So this is their data, and one of their epidemiologists, Teresa McGeaney, did an analysis and came up with these findings, which are really, really important and really point to how absolutely critical it is for students to have input in the policies that affect them, in particular bullying and bullying reporting. So in your school, are the students given a meaningful way and probably an ongoing way as the years move on to offer feedback and suggestions about this policy, particularly the people who have experienced bullying? I mean, we know that's a very common experience. So it would need to be a pretty broad and acceptable means for contributing this feedback. So do you see that at your school, and how might it be done better?
So Layla, go ahead.
Sorry, I know I've talked a lot today, so I'll try to keep it short. But just like this is sort of going around this question, but one thing that my school is actually working on is being able to create like at least a weekly intervention that's in school, that students would have the chance to like classrooms would be able to have the chance to have like in-depth discussions, if that makes sense, just to be able to have like more awareness to things. And it would also be a chance to offer feedback. So I think like, I mean, I think that in a sense, some students can take these discussions not in a serious way, but some other students won't take it in a serious way. So, I mean, one thing that I would recommend, even if we could do it virtually, is that if we were to have like, I guess, group discussions or some sort of like, I'm not sure what the actual intervention could be, but if we were able to have like break rooms where a group of 5 students could come together and talk, and then like maybe adult representative could also be in the break room, then that would offer more chances for students to feel more comfortable sharing, if that makes sense. Just like with our current situation.
Thanks, Layla.
Thank you. All right, Gracie. Or did I see a hand? I may not have seen a hand. Sorry.
It's okay. At my school,
Or was it
I
Sophie?
sometimes feel.
Okay, go ahead. Sorry. Go ahead. Go ahead.
At my school, I sometimes feel like they actually tend to protect bullies. They don't tend to take it very seriously, or they try to say that maybe we're just taking something they said the wrong way or things of that nature. And I know a lot of kids have stopped reaching out completely and just tried to handle it on their own because of this. And it's really disappointing to see.
Right. So that would be an example of students feeling like, okay, if we have a bullying reporting policy, it's not working for me, so I'm not going to use it. And that leaves people feeling unsafe. And clearly, according to our Kentucky research, is correlated with a higher, rate of suicide attempt.
Okay. Caleb?
Hey, so here at my school, I'm not as much concerned about the ability to report bullying. I'm more so concerned about the, I guess you would say, execution. Is that the right word? Of school policy, especially in regard to discipline and working to address why bullying is occurring. And I hate to say it, but I'm going to be honest here. I think that sometimes, depending on, given that I'm from a small community, I think sometimes in the past, especially, I've seen that, and our school has seen that maybe sports players or students with a certain last name and that type of thing are, and I hate to say it, but they're given a break when it comes to the way that they treat others. Now, it's not so much a problem in the present, but in the past, I've seen that occur, and that is definitely a concern of mine. Ensuring that students are receiving adequate discipline when they are being mean to someone else, ensuring that bullying is being addressed at the school level appropriately, and that all school policy is being applied evenly to every individual rather than certain students being treated differently and not receiving as harsh of a punishment as someone else, especially in cases where that's because of their last name or because of the sport they play or because of that type of thing. Thank you.
Okay. Thank you, Caleb. Anyone else? Lots of people agreeing. A lot of people agreeing with your. I like the discussion and the building up in the chat. Sophie, did you want to add? I know you had a couple of comments in there.
Sure, I can speak to that. So one thing that I think is very important is when you're developing this policy, you want to include students and the development of it because they're the ones that are most affected by it. And so including them, especially with things like outlining protections and disciplinary actions that happen, and things like when you have like a bullying policy, the language is important. And yes, we can give a blanket statement that's like all students are protected, but it's really important to name each like marginalized group or every way that somebody can be discriminated against, because when you outline and say it by name, you can't deny or say that you didn't know, that you couldn't say that to them because it's discrimination. And so having bullying policies that clearly outline every group and all the protections that that group has, and then saying that it is not permitted and that students will face repercussions if there's evidence of bullying or discrimination, and following through. And if staff is not following through, having a way that students can report or like kind of speak to someone about it. So something like if they report it to teachers and teachers don't, having a way that students can then talk to administration about having repeated instances of discrimination and bullying.
Can I just poll everybody to into the chat, type yes or no? Are students at your school given a seat at the table or given voice that you're aware of in relationship to their bullying policy or behavior, code of conduct policies? Just yes or no, yes, you're aware that students have in the past been given those opportunities, or no, you've not seen that? All right. So right now, yeah, the overwhelming response from everyone has been no, not that you're aware of. So this is definitely something that I definitely want to put on my radar to impact how I lead moving forward to incorporate student voice as I work with schools. So thank you.
Well, and I also think this goes to Blake as we talk about, with COVID-19 and how we proceed forward to the talking points that you all are going to talk about as well, with this mental health and COVID I think this really speaks to the many things that we're trying to do as a department as well.
Yeah, and a lot of times, the easiest solution is sometimes to put something out, but if students don't feel like they have voice, then they don't believe in the end result, and that's just as important as having a policy.
Well, thank you all for being honest and sharing that with us. Are we ready for the next slide, or tell me how you want to proceed?
We are, yep.
Okay.
Okay. So in years past, our suicide prevention has focused on training students and staff to look for warning signs, risk factors, encouraging students to be kind of like that gatekeeper, or to be just on the lookout for peers that might be showing tendencies or signs of suicide. But during times of trauma, which I think is fair to say we're all in a time of trauma right now as a country, it's important to acknowledge grief and loss, focus on help seeking, build coping skills, and give access to resources. So on those bottom four areas, as we move forward, which one of those four do you feel like is the most important for us to look at and make sure that we are addressing? Obviously all four are important, but is there anything that stands out, and could you speak to maybe why that stands out to you right now?
And you can either put it into the chat, or if you want to raise your hand and speak.
Yeah, either way would be great.
So coping skills, a lot of coping skills.
Yeah.
Looks like Jack has his hand raised. Jack, go ahead.
I'm also with coping skills, just because I think that building all those can really take in all the other periods, so to say, or areas. Because whenever you learn how to cope with your trauma or whatever you're experiencing, you have the access to resources, and you're willing to go and seek help. And with all that, like, it's not just you that's experiencing it. You also inform other people, and with them going through this curriculum, they will know how to acknowledge that. And I think that just having those coping skills can really change the stuff like on it. I guess, if that makes sense.
Yeah, absolutely. Thanks, Jack.
Looks like we have another hand, Miles.
I also agree with building coping skills. Really just because like one of our main goals in school is to prepare children, or not children, but prepare us for like real life. And I think one thing that we must come to the conclusion is that bullying happens in adult life as well. And so if we can find ways to cope, it'll make our journey through life a lot easier. And if we have schools and teachers and faculty that help us build these skills early on, it's going to be a lot easier for us to travel through life.
Thank you, Miles. Viviana?
I also think building coping skills is really important because it kind of focuses on being proactive rather than waiting for like disaster to strike and then acting upon it. So I think if our students are able to have appropriate coping skills, then we'll hope that we don't really get to the point of, thinking about suicide or more of like self-destructive behaviors. So if we focus on that, I feel like it'll really sort of help build like a better culture in general.
Okay.
Thanks.
Great. All right. Some also good comments in the chat there. We'll go to the next slide.
So again, this is just the KRS, or the statute that requires all staff each year in grades 6 through 12 must be trained with a minimum of 1 hour. Typically it's a video that we watch, or we have staff watch. All right, so you can go to the next slide. Okay, and actually I'm going to put up the, I'm going to, in the chat, enter in the, a link, and that is for the Society for the Prevention of Teen Suicide. And so that is one of the recommended organizations that will be used to reach out and offer training, suicide prevention training for students at home over the next, I guess, month. So by September 15th, schools are still going to be required to get that training. And later today, I believe, is when KDE is putting out the recommendation that that this could be used as one of the resources. And I guess my question for you all is, how do we ensure that students take the time to log in and do what they need to do to go through this training by September 15th? So what are some ways that we can and schools can make sure their students are taking these steps?
Let's see, we have a hand up. Viviana?
That was from last time, sorry.
Oh, okay, gotcha.
So the resource on that website is called Navigating Back to School, and that's going to be the resource that, and I believe it's going to be a requirement for students to log in and create a login, which is an extra step that may be a hindrance for some. But I guess.
You all think? Oh, go ahead.
Yeah, go ahead, Tony.
I was going to say, do you all think, obviously, the statute says September 15th. Is there a better way? Are we reaching you with the videos? What are your thoughts on this? So Layla.
I think so. I mean, for my school personally, I know that for the most part, we watch a video and then maybe somebody says like, so it's pretty much a very vague, I guess, talk or way, like, I can't remember what it's called, but way that's like this requirement is not, I feel like it's not totally fulfilled, if that makes sense. And then I know that in the end, there's typically like some sort of form that we can fill out saying like whether or not we need or would like to talk to somebody. And from what I'm understanding, if this resource is only through videos, it may be possible that it may like actually get get to students or like create an awareness, but I also feel like students could easily bypass it. And in some cases, it's possible that those students may not need those resources, if that makes sense. Like they're fine, they feel okay. But there are other students that may need some sort of help, and it's possible. Like I feel personally that it's possible that these students may not feel connected just through viewing a video, if that makes sense.
Yeah, absolutely. And I think the struggle right now for many is that we still have that statute that needs to be met by September 15th. Tony, if you go to the next slide real quick. Maybe not. Well, anyway, so one of the good things I think to come out of all this right now is that the realization that, what we're doing is not enough, and opening the door for further conversations. And so, actually back one, Tony. So the goal for us right now is to have a booster suicide training. So, we'll be able to meet the letter of the law by September 15th, but then over the next few months, work to create more resources that schools can use by, January. Hopefully everyone's back in session at that point in person, and do something a little more in depth, something that, is not just checking a box, but actually meeting the needs and opening the door to those conversations of resiliency and support, and some further steps that students need and staff needs as well. So is there anything else that we can do, I guess, to ensure that students are getting that initial round of trainings by September 15th? Is there anything else that you all can think of?
Drake, I think you had a good point. I think I scrolled down. Do you want to share what you had said?
I just talked about like how resiliency training would be helpful and just making sure we have adequate resources.
Gracie? I think the point you're making about, whether students are honest on the forms is a concern. Is that?
I know like a lot of kids, even after we'll fill them out, we'll be at lunch or something, and kids will literally talk about how they lose focus, they're scared to reach out. And in some of those forms, some years they'll ask us if we know anyone that we feel needs help or that we feel we should be concerned for. And I think a lot of kids tend to lie about that too, because I really don't think it's a good way to go about it is asking other students if they think someone else needs help. Because it's like, I don't know. It's not really helpful. I just don't think the forums do much, and I don't think many people really care about them enough for them to be taken that seriously.
Thanks.
Okay. Thank you. All right. So Layla had a question. Is it possible that this booster could take place over a class Zoom meeting and utilize break rooms? Then maybe students might feel more open to speak or take in the training information.
Yeah, right now anything is a possibility. And so, schools have the ability to kind of pick and choose what they use. We're on the side of putting out guidance and support so that schools can meet the requirements, but we're trying to do so in a way that's more effective than than has been in the past.
Okay. All right. Any other? Go ahead.
Sorry, one more thing. So I was on a Zoom call or a Teams call yesterday, and we were talking about this training, and there's a crisis text line that Kentucky is partnering with. And so if any students are looking for a project or something to take on, they're actually working with the crisis text line to come up with a Kentucky specific tagline. So right now it's, text the word home to that number. So it's the red box at the bottom there, or the red text. But in the future, Kentucky will have their own, so if there's a word that we feel is more suitable for us, something that we could build a campaign around, then they'd be happy to work with us. And this student advisory council came up as a possibility to get some ideas from. So if any of you are, sometimes looking for projects to take on, my email is above there, and I can put you in touch with Beck Whipple, who is kind of leading that initiative.
Perfect. And we can put that into the exit slip as well for you all to say if you're interested. Do you all have anything else you would like to bring up during this discussion with Blake or Kath? Do you have anything else you would like to share? All right. Well, thank you guys very much.
Thank you very much.
We appreciate you taking the time. I know we're running a little bit late. We'll move to the last agenda item, which should be a little fun, hopefully. Megan, are you on?
Hey, yep, I'm here.
Okay. So we have been hard at work with the videos that you all have submitted. And we wanted to just give you a little preview of what we have so far. We have not premiered these videos yet. So just to kind of catch everybody up on what we've had just a little unofficial meeting with the advisory council. And this year we're going to be doing some more projects with the council, and they said that they would like to participate in the Governor's Mask Up Kentucky initiative. So in the last week, they sent us some videos, some video clips, and we are working to put those together. And Megan, our phenomenal video editor, has put something together, and we're going to share that right now.
And sorry, are you sharing that or you want me to share it?
Can you share it? I'm afraid I'm going to mess up.
1 second. All right, you see it?
Yep, it's starting up.
Hello, Kentucky. I'm Jason Glass, the Commonwealth's new Education Commissioner and Chief Learner, and these are some of the members of the Kentucky Department of Education Student Advisory Council. By simply wearing a mask, I can limit the spread of respiratory droplets, the main vehicle for transmitting the COVID-19 virus. To return to in-person classes and to begin returning to a sense of normalcy, I'm asking you to please mask up, Kentucky.
So that is one of the examples that we have done. Not sure what you all think about that, but that's kind of one that we've done. And then we also have all the little short ones that you have submitted to us. And I'm not sure if Jacob is still on. Jacob, are you still on? Or if Megan has the other one we were going to show?
I do not have that one.
You don't have that one? Let me see if I can show it. I think it's Logan. Is Logan on? I don't know if Logan is still on. Actually, I think it's Logan's, but I don't have it. I don't know if I can get it up really quickly. Hold up.
Yeah, I'm on. Sorry. I'm kind of doing in between two things, so.
Oh, that's okay. No, that's okay. I was just going to show you. We actually were able to get your video done pretty quickly. So hold on 1 second. I'm going to share it with everybody just so you can see kind of what we've done. And again, we're going to be kind of just rolling these out over the next couple of days. You'll see them. We'll tag you if you're on social media to participate, or just to, you can check them out. I'm going to try to see if I can do this without messing up here. Hold on a second. All right, I'm going to share my screen, and I'm going to share the volume. Megan, I'm not seeing the option to share my volume. Oh, wait, there it is. Okay. All right, guys, here we go.
Hello, I am Logan Justice, a junior at Paul Lawrence Dunbar High School in Fayette County, and I wear my mask so we can keep everyone safe. Mask up, Kentucky.
All right, so awesome. Thank you, Logan. A little round of silent round of applause for Logan. Everybody has done a phenomenal job. They're going to look just like that for the most part. Just little snippets on social media. We'll do them on Facebook, Twitter, Instagram, and roll those out. And you'll see them here in the next couple of days. Do you all have any questions about those things? Wonderful, wonderful. Viviana, we had submitted, the deadline was last Friday on those. If you want to submit an individual deadline, you could probably still do that. Jacob is going to work on doing the individual ones, but for the big one with everybody putting their masks on, that one is, we've done that one, but you could still submit your individual one. So, and I can send you the instructions on what you need to do. So. All right, guys. Well, I'm going to send you, I'm almost done with the exit slip. Check your emails. You all did a great job on filling out the exit slips. I believe we were almost at 100% last time. I think I had 26 out of 30 of you responded the same day, which is phenomenal. You will get that email from me here in about 5 minutes. If you can fill that out as soon as possible, that would be great. Our next meeting is September 15th. The hours are a little different. It's going to be from 8:30 a.m. Eastern time, so 8:30 a.m. I know I apologize for those of you that are an hour ahead of us in Eastern time. Sorry, Jack. And those of you in the western part of the state, as you come closer to here that I'm asking you to get up at 7:30 in the morning. And then it'll probably go till about 11. So all of that will be in the details. I'll send you the invite and the agenda will be forthcoming as well. Kevin, are you still with us? Kevin may have had to get off because we went a little bit long. If he is not, then I can make sure I sign us out unless somebody else wants to. Oh, looks like Regina said, I know you're over time, but if you want to hang out after this is done and check your email for contact information. Yeah, Regina said she's available for any kind of troubleshooting issues. So if you all are able to hang out and check your email, she can work with some of the troubleshooting issues.
Yeah, so either right now or if you don't have time right now, you can check your email and we'll set up a time.
Okay. All right, guys, thank you so much. It was a great meeting this morning, and I look forward to seeing you in a little bit. We may actually meet before the 15th of September. Just check your emails and your group me messages and look for your exit slips. Have a great day.
Regina?
Yes.
Hi, this is Audrey Lambert. I'm one of the interpreters.
Hi.
I have a question. Hi, do you have just a second?
I do, yeah. I can hang out here for a while.
My question is, every time they show the slides on my screen, we go down to the bottom and we become very small.
Mm-hmm.
Is there a way, 'cause I pinned Shannon and I also pinned the student. Is there any way to on my end to be able to make the PowerPoint smaller that would allow my pinned tiles to get bigger?
So you have the ability to toggle between either the presentation or the pinned videos. If you click on the video from the thumbnails along the bottom, when it switches, it will minimize that presentation slide and then bring back up your pinned videos. But right now there's no way to make that PowerPoint presentation like a third pinned video, if that makes sense.
Yes, it does. And there's no way, like on Zoom,